one of our fabulous Astria house calls. And today, on this special day, anybody out there know what day it is? Yes, you do. It is National Nurses Day during this Nurses Week. And Melissa Waggoner, Waggoner or Waggoner? How do you
Waggoner.
Waggoner.
Yeah.
Put an extra, syllable in there.
Yep,
Okay.
got it.
Melissa Waggoner, don't get it wrong, or she'll give you 2 shots instead of 1. You know what I'm saying? She is a nurse. You're the sort of the head cheese nurse down at Astria, right?
Yes, I am the Chief Nursing Officer at Astria Sunnyside Hospital.
So, look, as a guy who's done his fair share of time in hospitals, I can't tell you how fabulous I think everybody in the nursing profession is. When we're at our worst, you guys are at your best, and it's what we so need. So I salute you on this day and all other days. Nurses really, they make all the difference in the world. The doc may get the glory, but the nurses who do the work getting us there, getting us through the procedures and taking care of us afterwards and all of that. So what is it that drew you to nursing? What's your motivator?
So I actually knew from a really young age that I wanted to be a nurse. I had a special needs brother, and so I really grew a passion for taking care of people. And I knew it from 16, and I followed that track all the way here. Did you have one of those little white nurse kits as a kid, like for Christmas, you know, the stethoscope and all that? Yep, all the things, the little hammer.
That sets the hook on so many girls, that really does. But guys, too, what's the breakout in, say, the nursing crew in Astria? Are we talking men to women, 40 to 60%, or what do you think?
I actually think it's a little bit less than that. Yeah. I think, they're equally capable, but I think that it's definitely more a profession that women go into, even though we encourage men to do also, take that on.
Gotcha. When it comes to, everybody likes to promote their organization and where they're from, and we are pleased to have Astria in here on a regular basis talking about everything from, neurosurgeons to orthopedic surgeons to clinical mental health practitioners and all of that. How do you describe or define the nursing role at Astria? The standards that you set, what you hope to provide with patients? You're setting the stage. What are your guidelines, your mottos? What do you go by to make the experience for patients healthy and make them want to come back, even if they don't have to?
Yeah, I think that at Astria, we really focus on taking care of the whole patient. It's really important for us to keep our patients in our communities so they can be close to home and those that they love for support systems. A lot of our nurses are from the community, so they take a lot of pride in making sure that our patients are well cared for, that their families are well cared for. So we really just focus on that excellence.
That includes you, right? You're from here. It's like you're taking care of the place where you grew up. That's got to be a special feeling, right?
That's right. Yep. I went to school here in Yakima to get my nursing degree, and then I started as a baby nurse at Toppenish, and have moved kind of all over the country and back, and so came back to home. Now,
do you get, as the director, do you get to do as much of the hands-on, or is that one of the things that you have to give up to get into the administrative roles?
So me specifically, I was ER trained. That's been my background. But anytime I hear an overhead page for a trauma, or I'm out there. Yep, you'll see me boogieing down the hall. So, yeah, it's still a passion of mine. I haven't given that up. My day-to-day work looks a little different.
Yeah. Have you said anything about National Nurses Day?
Duh.
Okay, I'm just checking.
Lance's very capable daughter is a nurse at Cadillac?
At Cadillac, right.
Yeah.
How does celebrating National Nurses Day help strengthen your morale?
So I think that,
question.
I think nurses are so selfless and they give so much to their patients that it really is such a important day to make sure that they know how much we appreciate what they do, and we just highlight all of that selflessness that they do provide to others.
How can the community thank you today? How can they thank a nurse? Simply by saying thank you, I guess.
Simply by saying thank you. I think that goes a long way. I don't think that nurses expect to be thanked, but I think it's really nice when they are.
Well, I just, I equate teaching and nursing in many ways as the same. You pour out all the time. You don't necessarily get back anywhere near the equivalent of what you put out in terms of energy and effort. And in your case, with patients, you wonder that they're going to be okay. You do, I would think, have a tendency to take some of that home with you. And then there's the cases that don't go well. And then how does that affect you emotionally? It takes a special person, I think, to be able to deal with that on a regular basis. What do nurses do to refuel? How do you guys recharge for the next run? Or is there we all go out for margaritas on Thursday, or what? Is there anything like that?
No, not so much. I think we really do try to focus on recognition and taking that minute to huddle after something traumatic, to discuss it, to talk about it, to check in on each other. We like to make sure that our nurses are off the floors for their meal breaks. They really get that recoup time. I think that's something that we really try.
But they're kind of a team, and so teams can be self-sustaining, right? Us against the world, us against the medical problems of the world, and I got your back, you got mine, that sort of thing. Does that exist?
I think that it's super strong within the nursing community. I think you have to work united to make sure that our patients have the best outcomes, and also to care for each other, especially coming out of COVID.
Being on the radio right here, you got a bunch of people listening that want to be nurses. So you're inspiring just by talking about being a nurse, I think that's really cool.
Yeah, thank you.
And you, did you say you went to YBC?
I did, yep. For my nursing degree, I went to YBC, and then I went back for continuing education when I was in Cleveland. But
awesome.
Yeah, I'm local.
Because I noticed that Yakima Valley College is accepting applications for the Associate in Nursing Direct Transfer degree, but they've got a nursing program. Get involved in it, yeah.
Yes, they do.
You can do that all locally here.
You can.
My daughter was a student of Heritage University at their nursing program, so hey, we can grow fantastic nurses right here in the Yakima Valley.
Here's the creepy question. What's the nastiest kind of patient you got to take care of, or condition?
Oh, goodness sakes. I would say, we really just try to meet the whole patient, and sometimes, there's emotions or behavior that comes into that where it makes it a little bit more challenging. But I would say that for the most part, nurses are well equipped to care for all sorts of patients.
Because let's face it, like you said, when we're not at our best, when we see you, we're yelling for pain, and we need to go to the bathroom, and don't let that person visit me, and whatever. I have so much respect for you. Like I said, I've spent my share of time in hospital beds, and became really good friends with a nurse and her husband, and were pals for years, simply because she gave such care, and I felt so secure that whatever question I had, she would have an answer for, and do all that. I was convinced that she was doing everything in her power to make my stay as possible, as comfortable as possible. So much love for our nursing people. So to you, Melissa Waggoner from Astria, the theme for this year's Nurses Day: our nurses, our future. Empowered nurses save lives, and don't we know that? Especially when you're in the old emergency room and the trauma and all of that. So you deserve a month, not a day, but here's to you. Last word is yours, on behalf of your profession, on behalf of Astria, or whatever you want to say.
Yeah, I just want to take a moment to the nurses that work so diligently and give so much of themselves. Happy Nurses Day, Nurses Week to you. You are seen and appreciated, and Astria is so proud that you're part of our organization.
Take a nurse to lunch, just don't be creepy about it. Okay. That's my advice. Melissa, thank you for your time today.
So much.
We appreciate it. I can see you just your personality is such. You are a fabulous nurse. So to all the folks that are in the nursing world in Astria, God bless you. Thanks for what you do. And the morning news continues here on NewsTalk 1280 KIT.